I will. Again, thank you all for joining us on this webinar, Safe at Home, Tools and Devices for Aging in Place. I'm really excited about this webinar and excited to hear your points of view and your experience as well. I have gotten a lot of this information from research that I've done for my clients and that my clients have offered to me, as well as colleagues in the field. So there's lots to discuss. I do want to start by saying I know that there's a lot of high-tech devices out there that are super high-tech, or we know about, your Alexas and Googles in the home, smart watches that can detect all sorts of things, your blood pressure, your vitals. That's not what we're going to be focusing on. We're going to be focused on a little bit more mainstream things, but if that's something you're interested in, please email me, let me know, and maybe we can have one just on that. I know my colleagues in the field that have residences, they have lots of wonderful things that they've been utilizing that we can learn more about as well. So my name is Nicole Christensen. I am the president and founder of Care Answered. We provide patient advocacy and care coordination. We get healthcare done. I'm also the author of From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. I am with my friend and colleague, Kim Kessler from 101 Mobility, and she's going to share about what they do and the wonderful equipment that's out there that you may not have thought about that can be so useful. She's helped a number of my clients really be able to safely stay at home independently. So without further ado, the first thing I'm going to start with is adaptive clothing. Again, to make people as independent as possible, or to make their caregivers more easily able to help them with getting dressed and that kind of thing. I feel as if it's not one of those things that are talked about very often. This is not only for older adults, but people with differing abilities. So a lot of it is in the picture on the left. You'll see sometimes it's a back enclosure rather than a front, and it'll be Velcro or magnets that really make it so much easier, especially with people with difficulties with their fine motor skills, to be able to dress themselves. And they have it much more fashionable than used to be. So keep that in mind. It might be helpful for you or a loved one or a client to be able to better assist themselves in the activities of daily living, like dressing. Again, Velcro and magnets seems to be the closures that have been most helpful. The other thing that I want to talk about is something that we're probably comfortable with and know about, and those are medical alert bracelets or jewelry. One thing I want to say is the difference between ICE, in case of emergency, jewelry or bracelets versus a medical alert. So ICE means in case of emergency. So that generally has the emergency contact name and information, as well as potentially the person's name that's wearing it. So that's great if somebody needs to be contacted, but that's different than a medical alert. So a medical alert has whatever the diagnosis is that you may want people to be aware of if you're found or if you're incapacitated for whatever reason. Some of the most common diagnoses for medical alerts are diabetes, severe food, drug, insect allergies, seizures, Parkinson's, dementia, some cardiac issues. Again, you will know by speaking with your primary care physician or those of your clients or loved ones about what might be best. I personally kind of combine them when I can. So it has the diagnoses as well as the contact, the ICE information. I think if you can do it, if it can fit, sometimes the front of it would have the diagnoses and the back would have the ICE. I think that's very, very worthwhile if you can fit in that information. It has helped my clients and personally family members. The other thing is, as you see here, I copied and paste bracelets because there is, and it may not be all the way true, but I feel as if bracelets are easier to notice for emergency personnel. That is a thing. So what I hear often is that chains, if it's on your neck, sometimes if an emergency happens and it goes behind you, uh, potentially they may not look for the charm that says it's a medical alert. So that's just my feeling. You do what is right for you. Um, the other thing that I would say from my experience is that sometimes people wanted to make the bracelets or whatever the jewelry is for medical alert more their style, right? Which is great. And you want to, whatever's going to make the person most comfortable is what probably you should do. However, I feel as if it's important to notice right away that it's a medical alert. I don't want there to be any, you know, thinking potentially that, oh, that's just a pretty bracelet, I'm not going to look there, or that's just a pretty necklace, or what have you. So I personally like it to stand out as being a medical alert. However, again, people have different comfort levels with that. One of the things that happened, that I was in a group actually of those that have been diagnosed with Parkinson's, and they were sharing with me how often is the case that they will find themselves, you know, they're walking along or what have you, but because of their mobility issues, and sometimes they can become confused, there's a thought that they're intoxicated, which is horrifying because they're not getting the help that they need. So they were sharing with me that they find it very important, and they tell all of their friends or loved ones that have Parkinson's to definitely get one. Does anybody have any thoughts that they want to share in regard to that? Oh, okay. Peter said something in the chat. His girlfriend's mother is in hospice, and the little trick we have learned is to cut her dressing gowns up the back so she can lie in bed without the bunching, much more comfortable for her. Excellent. That's really smart. Thank you for sharing that. Okay. One second here. Okay. Now, personal emergency response systems, sometimes called PERS. They're, you know, from TV, if you're old enough to remember, I've fallen and I can't get up. Those kinds of systems, generally a button, we think of a button that will alert emergency, 911. So there are 4 important questions that I think for deciding and discerning if PERS is good for yourself, your loved one, your client, and which kind you might be most appropriate. So the first one I put here is their understanding and capability to use a PERS. I say that because there are some clients that have dementia, and they're far along enough in their diagnosis that unfortunately the understanding to press the PERS is not there. So although they have it on them, God forbid something happens, they may not know to do it. So that's one thing. And again, if somebody doesn't have 24-hour care and they're in need of it, there might be another system that might be appropriate if they have that same kind of cognition difficulty. But it's certainly something to ask doctor about and think about. The other is with a PERS system is, do you want a home-based model? meaning, or a mobile one. So a home-based is as it sounds. So it's going to alert at home. Maybe some of us are know about the systems that if it's pressed, it'll call out to you. If you don't answer, potentially they will call 911 to get you assistance. Or if you do respond and say, oh, I just did it by mistake, then they won't, as long as you know the passcode or what have you. So that can work effectively, especially if somebody is homebound. The other question is, should the system be monitored, like 24/7 monitoring? I feel as if this isn't really a question. It should be 24/7 because we don't know. That's the whole point. It's an emergency. We hope that there's never an emergency, but there has to be something monitoring it so that they can call for assistance when necessary. The other question is, does it have a fall detection? So not all PERS systems have that. So if there's a concern that somebody may fall at home or outside of the home, and that can be detected, then look for a system that has that. And going back to the home-based or mobile, I talked about the home-based, but the mobile is if you're outside of the home, will that there still be some sort of alerting system, whether that's calling emergency and a loved one or caregiver or not? So those are really good questions to determine. Some of these questions were from a Consumer Reports, and some of them I created from my own experience. Does anybody have anything to share on that or any questions on that? Okay, so we're going to go to medications now. Now, unfortunately, as we may know, medication errors are lethal. So when we're home, the fact that we know what our medications are, when to take them is crucial. So I have 3 different formats here. So the first one on my right is for at home or on the go. If you see, you can, it has the days of the week, and then it has the 4 compartments: morning, noon, evening, bedtime. I like the 4 compartments because oftentimes my clients have a bedtime medication. So when it only has the 3, they're missing out, and sometimes they'll try to make do, and that can lead to accidents. So I prefer the 4 because that's generally how people's pills are laid out. This one that I've pictured here has it to go too. So you could take, if you were going away for 3 days, you could take, Thursday, Friday, Saturday with you, and then you can have it on the go. One of the things with medication containers is it kind of depends on the dexterity and the comfort level of which kinds you buy. So I find that it's helpful for many people to go to an actual store to kind of feel them out, because some people have tremors or their ability to grip is a little bit different. So finding the best one for each person, I find is very useful, doing that little research for yourself. Again, I want to let you know that I don't sell or endorse any of these products. That's why I'm not using really brand names, because it's very personal. And what's right for you may not be right for the next person. And so sometimes people ask me when I do things like this, how much does it cost? It's gonna differ. If you want help with that, certainly at Care Answered, we can help you, as our client, to research the best ones for you. But I just want you to have that general information so you can have access to the tools and devices that would best suit you and your loved ones and clients. So that was the first one. The one in the middle is a blister pack, or this is a form of a blister pack, in which it can have the same kind of thing: morning, afternoon, evening, bedtime, but all the pills are packed for you. So if you can just push it through, You don't have to think about it. Nobody has to set it up for you, or you don't have to set it up yourself. There's also local pharmacies that do this for you, or they will help you put it in the cases and deliver them. So those are other opportunities. Then the last one I can tell you is the most costly of these, because it has all the bells and whistles, literally. So this is programmable, and the pills are in there, and it actually makes a sound and opens up for the time and the pills that you need.
Hi, Barbara. It's Barbara Fair. How are you?
Um,
Good. I got a call that I have an
hold on
appointment on
one
Friday.
second,
I don't have this
Barbara.
on my calendar.
You're not muted. I'm sorry. So the medications are held within there, and then an alarm goes off and it opens up, and then those are the pills that you're taking. So there's no access to the other pills for other times or other days. So people can't, by mistake, take out the wrong pills. Obviously, there is an option to override it if something is going on, or if there's a change or something like that. But that really helps with taking too many medications or not the correct medications. I see something in there. Oh yes, somebody said blister pack. Okay, what was the last one called? Lauren had asked. So the middle one is a blister pack. This is an autumn, and then the last one that I'm talking about right now with the alarms and it opening is an automated pill box. Now, some of my clients have been able to get some portion of it paid by Medicare. That's not necessarily the case. So you have, or whatever insurance that one might have. So definitely look into it to see if you can get some, if not all of it, paid covered. Okay. Next. Okay. Preventing wandering and fires. This is a big one. So let's talk about wandering first. You'll see here on the left of the screen are door locks and alarms. So if you suspect your loved one or client or friend of wandering, then it's best to kind of get that in check right away, because we've all heard, unfortunately, the nightmare stories of people wandering and then getting lost and not being found. So one is like an alarm on the door. So if you live with that person, or the person does not live on their own, an alarm goes off, it can notify anybody in the house that somebody stepped outside the door. So that can be very useful if there's 24 hours coverage of care, either paid or by a loved one. Then that can be okay. However, the reality is, we all have to take showers, go to the bathroom, that kind of thing. So that alarm would still be helpful, because hopefully they won't get very far. And if they have the capability to walk on their own, you would find them relatively quickly. However, to prevent that, you can also have a lock on the inside of the door. Now, one is a way to lock the door so it appears locked, but may not be locked, so that it's harder for them to utilize the door to get out, to possibly wander. There are also alarm systems that when they open, they actually notify loved ones. I don't think they notify, I'm not aware of ones that notify emergency services, but perhaps somebody here has a different understanding. So that is to prevent. The other really low tech way that some of my clients have used effectively, again, these are folks that have 24-hour coverage, whether paid or a loved one, is to actually lock the doors. So instead of having a deadbolt that you twist, that's what you would usually have inside, it's an actual lock, and they take out the key. so that they can't go outside. Some triggers, if somebody hasn't wandered, but you're concerned, is if they're wandering within the house, right? So an experience of, they're constantly walking throughout the house, or they may have difficulties figuring out where the bathroom is, even though they've lived in the house for many, many years. That can be a red flag, or at least initiate some questionings with clinicians as to whether they might be a wandering risk, and to look into these things. The other is the stove, right? That's a huge fear of turning on the stove, leaving it on, and there be a fire in the house. Or, they put something that's paper or something flammable on top of the stove and then turn it on, and they're home alone. So what you see here pictured on the far right is knobs covering for the knobs, so it's not easily used. So the stove and oven isn't easily used, and it's pretty complicated to get in. However, if your loved one has that cognition, that's not really going to help, because they'll figure it out. But most people, if they're in that stage, may not have the cognition, the capabilities to take that off or be interested in it, because it's not what they thought it was. That is, as you see pictured there, is a gas stove. I have seen for electric stoves or any other type, is a covering, kind of like you cover an outdoor grill, that makes it appear not to be what they're used to it being. So that might be good. And again, another low tech is taking the knobs off. I've had clients that have done that very successfully as well. Let me see. Do you have any chats or anything? Okay, let me go to the next. Okay, so getting up. This can be a very difficult thing for a lot of people. Getting up, transferring is what we generally call it, from sitting down to getting up. And there are these tools now available. The easy chair lift is literally an easy chair, right? That like lifts up slowly so that you can get out. Some of my clients who have a walker will have the walker in front of them, and then with that, they're able to get up and feel stable. Sometimes it's used in addition to, a caregiver being there to help to stabilize them or cue them. But that's something that is available. The other is the cushion lift, which is basically the same kind of contraption, but it's on the go. You can use it on any chair. So if you have that difficulty and you're going to a friend's house or to a restaurant, you can still have some assistance with transferring. And the last thing there that you'll see is bed rails. So if people don't have a hospital bed, but they're still having difficulties kind of turning side to side, or kind of getting to the right portion of the bed, this might be helpful, because they can use some of their upper body strength to help them get to where they need to be, or to move them, reposition themselves in bed. And again, those can be bed rails. You can find them to be attached to any kind of bed. Even if you have an electronic bed, but it doesn't have a bed rail, you can potentially find one for the bed. Okay. All right. Safe and sound. On the left here, it says clear date and time. I love these, and I'm seeing them more and more often in my clients' homes, and I do suggest them. It's just very clear. It's easy. It says very boldly the day of the week, the time, the date, the year. So I find those to be really helpful, just to get people refocused on where we are, especially during this pandemic, right? I think we could all have used that to figure out what day it was, or time, or year that kept on going. So that's something that's kind of an easy fix that people kind of forget about. The reality is that as we get older, our eyes don't get better generally. And so things are harder to see. So it's having something bold like that rather than the usual paper calendar can be really helpful for people. Camera monitoring, that's the next thing you'll see. So one of the things that has helped my clients and I find helpful is the Ring or whatever kind of camera doorbell type of thing, especially when people live alone, because then if it's on your phone or device, you can also see who's at the door and help to monitor that way. Also, camera monitoring in the home. So if somebody lives alone that you love and you're caring for, and potentially they have a paid care or they're just on their own, it's helpful to see kind of what's going on and keep an eye on them, even if you're far away or you're at work, to see what concerns are there. So, for example, I've seen folks that have a monitoring and they may not, they're not looking at it every second of the day, but then they rewind because, they saw dad and something wasn't quite right. So they went to rewind it to see what happened. And indeed, he had fallen. He got himself up, but he had fallen. And that gives you information and knowledge to see, okay, what are some things that we might need to have in place now? Because this is happening. I see it happening, and it's happening at much more regularity than one would have assumed without this monitoring. Also, you want to make sure that your loved one is being cared for well. So there's nothing wrong with having a paid caregiver in and having a camera there. You want to make sure it's not, you're not looking to catch somebody doing something wrong, but obviously we don't want anybody doing anything wrong, but we can see things and it gives people peace of mind and assurances, especially when they can't be there. So don't hesitate to use something like that. I find it very helpful. The next is a pretty simple device. It's a phone, right? But it has big buttons. Again, as I mentioned before, as we get older, it's harder to see things. And so it enables people to be more independent. It's also harder, even if you can see the numbers, to actually press the right numbers can be difficult for people with different abilities. So making it big and easy. On the phone that I have pictured, it has a picture of the face. And so you just kind of press the person and it automatically dials that person, which is really nice and makes it easier to keep in touch, which is so important. And the last is the remote control that you see there. Again, we have remotes for everything. Sometimes we talk to things to make them go, what have you. But sometimes when we're getting older, it's easier to have the easiest thing. You know what you like, you get to it quickly, you're entertained, and you don't have to figure out a whole bunch of things. So that's something that you can certainly look into as well, see if it might be helpful. Okay. Again, wandering and monitoring. So this is a little bit like what we were talking about the door. This is a mat alarm that's on the left-hand side, the black mat. So when somebody steps on it, it alarms when you're leaving or coming. That's great for indoors if somebody is in the home, or again, if you can find one that alerts to a loved one or caregiver, that would be super helpful as well. And again, if you also have a monitoring, then you're kind of seeing everything. Also, what I learned from my work with those that have dementia and those that are experts in that field as well, is that the black coloring also can be a stop for people with dementia from going out the door, because the black mat looks to them often like a big puddle, a hole, something like that, which they're going to be less likely to step on to leave. The other is a bed alarm, really important, because when people have to get up, maybe to use the bathroom in the middle of the night, we're all kind of groggy, right, in the middle of the night. And if we can get up and recognize, oh, we can't really get up on our own. We need to have our device and all these kinds of things. So if somebody is aware in the home, then they can go and assist them immediately so that they don't fall. And then just monitoring, how often are they getting up? If you have a paid caregiver there, how often are they going in? Or if you have a paid caregiver, it's an alarm that says, okay, get up, they're getting up. So it alerts you to go and help them as well. Somebody asked me, Lauren said, do you know if Medicare covers this? Some of them they do. For anything that Medicare covers, there's generally has to be a script for it. So definitely look into it with a primary care physician or any clinician that's going to be suggesting the use of these. Bring these in the appointments, bring these conversations up and these devices up and ask them if they think it would be helpful as well, because it can cover at least a portion. I know for the seats that we were talking about, they won't cover, the whole chair, the easy chair, but they may cover just the lift. Yes, Pam, thank you. For PERS, if you have community Medicaid, it covers that. So that would be an expense that you wouldn't have. Thank you, Pam. Okay, this one I call Let There Be Light because it's so important. So light everywhere. Shadows, we don't want shadows. We want to reduce falls. We don't want things on the floor that we can trip over and fall. So, light the hallways, have night lights, even motion detector lights. So if we're up in the middle of the night to say, go to the bathroom, as we're going by, it lights it up. Touch lights, rather than having to have the dexterity to twist the lamp on to be able to touch them. Those have been proven really helpful. And light to stimulate natural circadian rhythm. So, which I have there are the physical, mental, and behavioral changes that follow a 24-hour cycle. These natural processes respond primarily to light and dark and affect most living things, and most importantly for this discussion, human beings. So, as we've seen, some of us, I'm sure, have seen sundowning in our loved ones or clients with dementia, difficulty understanding day to night. The more light that we can produce, either actually or artificially in the daytime, and then we make it darker at nighttime, it helps people remember that this is actually a time of sleeping and winding down. So as much as you can do that within the home, the better. And get as much as natural light as possible. Getting outside, that does good for every single person. That vitamin D, and just it boosts you emotionally and mentally. And eliminate shadows. That's the other thing about being bright, eliminating shadows. Again, if somebody has dementia, those shadows, those dark spaces can look like dangerous places, or they can form in their mind something that's scary. So try to eliminate shadows as much as possible. And as I mentioned before, dark spaces can look like holes or bodies of water. So we want to eliminate that. Okay, urinary incontinence and sleeping through the night. So this is not something generally people love to talk about, and certainly Depends is making lots of money, but it's a reality, right? There is trouble with urinary incontinence as we get older, or if we have any kind of condition that affects it. So one of my clients actually told me about how effective it was for her mom. So she was getting up in the middle of the night to urinate, but she was a huge fall risk. And there wasn't somebody there at night to help her necessarily. So going back to community Medicaid that Pam brought out, it was before I got them 24-hour care. So in the night time, they utilized this external catheter, which allowed her to sleep through the night and not be soiled and wet. So can be a really helpful thing. And the same thing for men, a condom catheter. So it's definitely something to look into if that's causing a huge problem. Getting up in the middle of the night, again, we can be all disconcerted in the middle of the night, and disoriented is what I mean to say. And that can lead to more falls or accidents. Okay, contrasting and labeling. Again, it's very similar to the light situation and our eyesight changing as we get older. So one of the things suggested is painting doorknobs or door frames, different colors, like a saturated color that they can see. So slight deviations in colors, as we get older, we can't see them very well. I know of clients that have suggested, and even in facilities, that they'll color the bathroom door a specific color so that at least when they see blue, for example, they know that that's the bathroom door. Labeling drawers, closet areas, and food. Again, that gives a level of independence, and that structure is really helpful, especially for those with a dementia diagnosis. And putting corner protections on, coffee tables, things like that, that are in a different color, again, to avoid falls and so that they can see them well. Oh, I don't know what happened there. So those are the things that I wanted to go through. So does anybody have any questions or want to make us aware of other things that they found very helpful? You can take yourself off mute if you'd like. All right. Well, we'll have time afterwards too, but there's my contact information. Give us a call, email me. I'd be happy to speak to you. We do free consultations, so you can call and schedule that. And without further ado, I am going to introduce my friend, Kim. Hold on, let me stop sharing. And she's going to talk all about these wonderful devices. She's from 101 Mobility, and so they are experts. I've had clients that I've referred to her, and she has treated warmly and wonderfully and getting them the equipment that they truly needed.
Thank you,
So Kim,
Nicole.
take it away.
I appreciate it very much having me today, and also all at the times in the past that we have a lot of overlap, and we are all in this very fortunate space of trying to provide solutions for people as they get older, as the challenges increase, and really neutralizing those areas that we can. There are things that we can do, and it's just a matter of spreading the knowledge, spreading information so that we can share like different ideas. Well, this is me. We can move along from that. But we really need what my focus is from 101 Mobility. We are a company that adjusts and adapts people's homes so that they can move through their daily life. We really go through what is a day in your life like today? And then, as things are, as the crystal balls that we can use, we try to, see what's kind of coming in the future. Nobody
Kim,
knows for certain, but yes.
Kim, can you turn up your mic a little bit? It's a little hard to hear you.
Okay, let's see if I can do that. That would be, I have mute, or let's see if.
Or you know what, Kim, maybe just get rid of the headset entirely because you were perfect before.
And maybe, is that better?
Oh, now you're back.
Ah, there we go. Thanks for the tip. So we really take you through the home in terms of a day in the life. to see how you're getting in and out of the home, how you're getting upstairs to downstairs, how you're getting in and out of the transfer from your bedroom and the bathroom. These are the areas that really are the red flags that we're looking at. And we have small adaptations and more significant, depending upon the different situations. Your staircase is the very first thing that we address, because you're dealing with the hard surface. You're also dealing with, you know, your fall is the distance that you're spanning. And then on top of that, those two things combined together, the outcome never is, it's severe. So we address these topics and we move through little things we can do. Things you don't think of, oftentimes, like the staircase. When you're installing, you know, if you have the railing already there, that's one thing. It's something that everyone's adjusted to. But if you're getting something new, why not opt for the power grip, which is the round circular one, so that your hand naturally will cover the entire surface as opposed to just the pinch. Little things to think about as you're going up and down. All of these are circular. It just gives you that much more security and firmness around your handrails. In those staircases, again, top priorities. The two top priorities are your staircase and also getting in and out of the house safely with a ramp, let's say. And that is because there may not be a fire every day, but when there is a fire, there has to be a way to get someone out. So be it the stair lift and also out the front door, down and out away from the house with the ramp. Stair lift, no, I always say no one is born knowing about stair lifts. So there's a couple of different preconceptions. I always thought that the stair lift would be attached to like the wall, the side of the wall, or maybe I get questions all the time, will it damage my molding? It doesn't come near the wall. You think, I try to explain to people, think in terms of the stair lift working with gravity. The way the stair lift works is that there are platforms with screws, that the small platform, if you could see in the picture here on the bottom, that is screwed into the hardwood floor with four or so screws. Every 3 or 4 steps, there'll be a platform. And the rail rests on the platform. The chair is connected to the rail. These are all battery operated, and the battery charger is charged into the wall, plugged into the wall, in order to continuously charge those batteries, particularly when this the chair is in use, going up and down. Also, the seat and the hand rests, the arm rests, and the foot rests all fold up to the height to collapse up, so that they come within maybe a foot of the wall, so that other people can pass through that aren't using the stair lift. Also, all of the stair lifts come with both armrest controls at the very edge of the hand, where your hand would rest at the arm, as well as remote controls. So you keep a remote downstairs and you keep a remote upstairs, and you could, if one's upstairs, you know, you have a couple, and you could just have, let's see, dad used it already, now mom's downstairs, use that remote, bring that back down. So there's 2 different kinds of stair lifts. There's the straight stair lift and the curved stair lift. The first we'll talk about is the straight. They have options. You can do them inside or outside. They travel up and down in one direction. They have the most amount of options. You can purchase them brand new, you can purchase them pre-owned, and there's also rental programs that many of the companies like myself do provide. So that has the most amount of options for that straight rail going up and down. Pricing, I always like to share, starts, I start really just under $3,000 for a brand new. And you know, the pre-owns will be less, and rentals are $175 a month. just to get concept. Again, nobody knows. But the curved stair lift is a different conversation. This curve is created by, it's customized to a specific one and one, only one staircase. They are created, they're fire tilled. We use a company called Bruno that is in the United States, the best known, well-known company in stair lifts. And they take its photo imaging that clicks about, and then it's fire tilled to curve according to the specific staircases. They take, says 3 to 5. Okay, it's 4 to 6 weeks to create. And the pricing says 11. No, it's more like 12 and up. They are a considerable investment. But again, it's one, and very commonly on Long Island, we have our split level staircases. So you can see here, this is an example. We have the options. We could do in this second photo here, closest to the words, we can choose to do 2 straight stair lifts, which would give you 2 separate chairs. And that is a very significant cost savings. But when you're thinking in terms of, am I making this accommodation for the person in the house to stay the next 10 years, you know, are we talking about a 60-year-old or are we talking about a 90-year-old? And there's varying decisions to be made in between by families, but you want to see what the future is. And sometimes making the investment to carry with one chair pays off, because I can tell you, I do have the calls that we do, and you can do this too. You start with the 2 stair lifts. You're talking about an investment about $6,000. And they have called and said, you know what, we really want to switch now to the custom made rail to have one continuous chair all the way around. And that is, you know, you are talking about now double. Here are the ramps that I was speaking about. We do aluminum non-slip tread modular ramps. I explain the modular ramps much like Legos. They are the ones with the first I'm talking about, the modular with the handrails. They get put together in sections, and depending upon the configuration of someone's home, sometimes they need to make turns, and that's done with platforms. So this picture shows you the modular ramp with the handrails going straight. But if, let's say, you needed to go hit back around the other side, or if you can zigzag these depending upon heights of stairs and different configurations, which are all determined at the home with the family members to go over different options. And that's something most companies, including myself, are free evaluations to come to the home to give people options. What are the options I have coming out of, let's just say, for example, my front door? If you have just one step, look at that. That is a temporary, in the center screen, it's a temporary ramp. I am very reluctant to share with people the temporary ramps because of the handrails. There's only an inch lip on either side. So this must be something that's used temporarily with assistance. You'd never put someone on a walker or, you know, on their own on a wheelchair on something like that. It is not meant for a permanent use. Although I also want to say, in terms of ramps, all ramps are temporary. None of these ramps, particularly the modular on the left with the handrails, nothing is cemented into a building. There is no permanent fixture here when it comes to ramps. And I get that question when people ask about permitting. Are permits required for ramps? No, they're not, because they're not permanent fixtures. It may take 3 hours for a complicated configuration where you have platforms and turns and things like that. I could spend 4 hours with a team assembling a ramp. And I explain to people that ramp can be taken down in 20 minutes. It's all set up there. Like, imagine taking down the Lego wheelbarrow, whatever. But so that's ramps. And another option, I use this a lot in Queens where there is not a lot of space in, let's say, the front, where you have outdoors 5, 6 steps to the stoop with not that much grass, let's say, to go out with a ramp. The vertical platform lift is an elevator. It goes most oftentimes outside, but it can also go inside. They're called porch lifts also, and they raise 4 or 5 steps high, sometimes 8 or 10. They're also used very commonly out east and on the water because so many of our homes after Sandy were built up on stilts. So that vertical platform lift, it carries the wheelchair and an individual up those stories, and it takes up a small footprint as opposed to a ramp that would be much further. Then this is to the left, our cutting edge, state-of-the-art feature, which is called a flex step. This is amazing. The woman in the wheelchair is next to a button. What she's doing there is she presses that button so that those steps that you see, they convert, they transform into a platform. So it creates a lift, a platform size, to bring you from that bottom up 3, 4, 5, 6 steps. And the lift brings you up just like a vertical platform lift would do. But when you get off, the mechanism turns that platform back into steps. It really is neat and an excellent example of what people I love putting it into families' houses. So if there's one person that's handicapped in the home, everyone uses, it's a space saver, everybody uses the steps. And then when the person who has the challenge with the wheelchair, they just transform them and it transforms back. Okay, bathroom safety. We do home modification. Bathroom modification is the most common because, again, those hard, slippery surfaces. What we do in the bathrooms a lot of is we are very sensitive to the seniors and their the cost accommodations of things. We do something called a tub cutout. Let me see if I have an extra picture. I'll show you a little bit further. But here is, I'll go into the tub cutout when I show you with the tub, although I could illustrate it. But the shower pans, taking out the tubs and transforming with a shower pan so that you have that zero entry into the shower is really game changing. When they do have the tubs, and let's face it, so many of the homes on Long Island, they've one bathroom with the tub, and that is just very tricky and tough for a person just who is unsteady, let alone someone in a wheelchair. So that's one of the first things we do is we change out that tub for a zero entry shower. We also do the bathroom toilet heights. We raise those toilets. So that can be an assistance, as well as pedestal sinks are fantastic in the bathroom so that a wheelchair can go under. Here's some examples of solutions with that zero entry. It's just a step out of the tub. And here is I'm just illustrating the fact that there is a tub, and the bathtub cutout that I was bringing up a moment before is something where we go in and we do exactly that, cut out a piece of the porcelain tub. And there is, it's called Clean Cut is the company that we use. And we cut out that section so that it's just a small step, not a hurdle into the tub. It's just a small slide in. And that Clean Cut has it's an edge that protects a wide opening in the tub. And so that it really transforms it into a zero entry or as close to a shower as possible at a very low cost. We're talking about it's a significant remodel of your bathroom with a tub, close to a $2,000 price tag. much different than doing a full remodel of the shower. And the other, we all know the shower chairs, but something to highlight with the handheld showers are the nozzles are fantastic to be used if somebody is in a wheelchair, let's say. But also the companies are making these handheld devices now. All of these are grab bars in addition to being the handheld devices. That's what she's grabbing on. So they have dual functions in the bathroom, which is a fantastic savings. Bed transfers. Falling out of the bed is such a common hazard for people who have mobility challenges. And some of the things that we offer are these aids for transfers. The lift chair in the center is something that Nicole brought up already, and that is, it's the lazy boy that is, helps people up. But the most significant picture I like to highlight here is something on my far right is called the super pole. The gentleman holding onto the pole in the bathroom, that is, it can be placed in, significant places in the bathroom or next to the bed. And people can use that to raise themselves up different levels. It's just like a suspended pole in the room. It's done by the ceiling to the floor, and they are done by suspension rods. And for additional security, we oftentimes will go into the studs in the ceiling or the floor for reinforcement, but they're created so that they're not movable, but they're an excellent source for assistance to get in and out of bed and in the bathrooms, to get in, up and down from the toilet and into the tub. People love the super poles. And then as things are due in terms of getting more advanced, we have ceiling track systems and safe patient handling. This on the far right, that is a trapeze with a ceiling. It's not the ceiling track, but it's a patient transfer system that's considered portable, actually, with the arc above of it. What we do oftentimes is something called the ceiling track system, which instead of the portable arc that you see, we attach it to the ceiling. And we have gone from room to room. So that trapeze can go and we do it nicely with moldings in the ceilings. And we go from the bed to the ceiling track. We'll bring in the trapeze through to the bathroom, and then even then into, let's say, the front room, which might be the TV room or something like that. And they can transfer into their wheelchairs or a stair lift from there. These are all modifications that can be done, which are, their costs are more modest than you would otherwise think. In terms of staying in your home, as long as you choose to independently. This is me, Kim Kuester. The dog on the left, the golden retriever, is mine, and that's her friend next door at the sign shop. And that is a golden doodle, and they are very fast friends, and they visit here at the office occasionally. And I would love to answer any questions. I'm locally here for people on Long Island and Queens and Farmingdale. And anytime anyone ever has any questions about mobility and lots of different options, we're here Monday, Friday. Thanks so much, Nicole.
Oh, thank you, Kim. That was
and
excellent.
your time, everyone listening. Thank you.
I want to say there was a question about the trapeze. It says, what is the upper limit weight that it can hold?
There's typically it's 300, but they do go upwards of, I want to say $600 and $700 pounds. They do have the bariatrics. It is created for them as well. So I would look further into it because there was just an expansion on that in terms of the weight capacity. and I'm saying just at a convention, I was just at a convention. Well, that was before COVID, but they are very much used in the bariatric world. They are increasing their weight standards. I would look into it to see what the maximum capacity is, but I know it's upwards of 600 and 700 pounds.
That's great. Thank you so much for sharing all of this. I think
Absolutely.
it's so helpful and there's innovations happening all the time, and sharing it with us so that we can share it with our clients, loved ones. It's really helpful. Thanks so much, Kim, for being part of this.
Absolutely, my pleasure. Thank you for having me.
And thank you all again for being with us. I look forward to hearing from you, and let us know if there's other topics that you want us to talk about, because I'm more than happy. A lot of the topics that we come up with at Kara Answered and the guests we have is because of your requests. So please feel free to let me know. And thanks so much. Enjoy your week. Happy June. And we'll see you out there. Take care, everybody. Bye-bye.